Patient Pal. Patient Pal is designed to address one problem that has two sides, which is patient satisfaction. So the way we've identified this is when a patient cannot communicate their needs, it's more likely they will not be satisfied with their care, which would be reflected in lower patient satisfaction surveys. Now, on the administrative side of this, due to changes in healthcare regulatory requirements, hospitals are now being measured in terms of how they're satisfying the needs of their clients. And even in some cases with regards to Medicare funding, hospitals are seeing an increase or decrease in funding. So our application, Patient Pal, will allow patients to communicate their needs without need to speak. It will add real-time patient satisfaction results that results into integrated survey results. And on the back end, it will allow hospital administrators, hospital systems to receive real-time data in terms of how are they satisfying the needs of their patients. So many patients in our healthcare systems have data collection methodologies. That could be paper and pencil, it could be a phone system, but often the information that they get is old, either by a week or 2 weeks, in terms of the interaction with the healthcare system. So what our app will do on the front end, which you're about to see in a little bit, will allow a patient to access what they need, request something from a caregiver, say a nurse or a physician, but that will then translate into a real-time survey that which can be integrated into the survey or data analytics or outcome measurements that the hospital system is already using. So for example, if a patient needed a glass of water, they would request it. Thank you, Imran. You will see the request is logged right away. On the right-hand side would be what the caregiver is receiving. And then when the caregiver is done with their shift for the afternoon, they would log out. And then you would automatically receive a patient satisfaction survey. Again, this is a very brief mock-up, but it would be integrated to whatever the hospital itself or the system itself is already using. We're going to close that and go back to the top there. So the value add that we have here is that, especially in the United States with the advent of the Affordable Care Act, hospitals, hospital systems, healthcare systems need to differentiate themselves. They need to build their brand by really showing that they can provide excellent patient care. And their outcomes are measured, their quality is measured. This is a tool that will allow that to the hospital administrators who would ultimately benefit from this in terms of receiving that data in real time. And as I said before, it will allow patients to communicate what they need without even needing to speak. So, as we close, I just want to recap those points. And if you would like to check out a working model of this, Imran built the working model right now, you can follow this link. You can learn more about our team right here, our bios, and the successes that we had. Thank you so much for attending our talk, and we'll be looking forward to your questions.
Thank you, guys. So they have a working model. That explains so much why these guys were locked up in the room all weekend doing
That's why we didn't go outside.
That's why I didn't go outside, so I don't feel as bad now. Okay, so I'm going to pass this on to our judges for questions.
Are you saying there's strong web-based feedback right now?
There is some. So the idea, one of the genesis for this version of this is that Medicare-funded hospitals have to deliver the HCAP survey, which they do to some of their recipients. But there's a huge lag time. It can be a week or 2 weeks in some cases. It's a quarterly thing. It's still done out of compliance rather than what we're trying to push the industry towards it's already going, is where hospital systems can really build their brand and showing through that, capturing that data in real time, their ability to meet the needs of their patients. So that's where we're trying to move hospital systems towards.
So what's the hardware element? If I have a patient in the hospital, what's the hardware element where I'm making this communication?
So the app itself will be compatible with smartphones, apps, what have you, whatever smart technology they would have. One of the issues that we would need to discuss further in terms of development is that if a patient may not have that, would there be an upfront investment from the hospitals to then purchase that equipment? So the flip side to that is that hospitals already have a cost built into whether it's paper and pencil surveys, a phone-based system to collect this information. So they're spending money on this already in an antiquated way that's not giving them that real-time feedback that say Taco Bell has when you order a burrito. So that's kind of what we're trying to go towards, not a burrito mentality, but more towards that real-time feedback to see what was my interaction with this system? Was it good? And so then you could tie that into whether it's a unit-based or team-based or individual qualifications outcome model that the industry is moving towards anyways.
But how do you manage, there are some patients that may not be able to talk or act. I mean, right now you need something, the hospital pull the plug and
Right, so the app, it's designed where like, even if you can't read in English, there will be symbols, like a cup of water or like pain or something like that. So basically, a patient just needs to be able to push a button to request something.
Thank you very much.
Thank you very much.